Cool. Tom, you there?
Yes, I'm good.
How you doing?
Doing better. A little bit warmer.
A little bit. All right, hold on. I'm going to have to, I think I got to redo this because I don't see you in my guest chat room. So let me go out of
you
this.
have to.
Let me do this. We got time. We're good. We're good. All right, let me bring this up. Chat room, talk show, redo. Do. All right, there you are, and there's guest 3 too. How about that? Still hear me okay?
Yep, sounds good.
All right. We'll get her going here now. Okay, here we go. Video's going. Yeah, okay. Hi, everybody.
Talk show. Recorded live.
Well, hello, everybody, and welcome back for another episode of GC Community Chat. I'm your host, Kerry, and joining me tonight is Wayne County Commissioner Richard LeBlanc and Dr. Tom Iwinski. This show is dedicated to you, the residents and businesses of Garden City, as well as the surrounding communities. Remember, we're working hard to promote our community and yours. Well, hello, everybody. It's Thursday, January 15, 2015, and you are listening to show number 229. I'm your host, Kerry, and tonight, our Commissioner, Richard LeBlanc, is celebrating a new addition to the family. His son had a boy today, 6 pounds, 9 ounces, Richard Thomas LeBlanc. So congratulations to him and his son and daughter-in-law. Everybody's doing good, baby's doing good, and hopefully Richard will be back next week. So congrats, Richard, Grandpa. I think this is like his 3rd one or something like that, so see how that goes. Also joining me, though, is our resident weatherman, Dr. Tom Iwinski. Tom, how are you?
Doing better than last week. We're a little bit warmer than last week.
Yeah, a little bit. And it's going to get better, I hear, eh, maybe?
All right. See what happens.
All right, cool. We'll get to you in a little bit. And we want to welcome those that are listening online and in the chat room, and to those that will be watching us on our YouTube channel later. We appreciate your support every week. All right, tonight we are pleased to have back with us Mr. David Jevahirian from the Marketplace Help Center here in Garden City. He'll be here in just a little while, and we'll be talking about the Affordable Health Care Act, or better known as Obamacare. David says time is running out, and we'll see what he suggests are some of your options that you can do. So, plus I think he's going to have some examples of different coverages that you can get. So we'll get into more detail with David in a little bit. Also, Tom will be here with all the latest weather, and Holly and Joey are back with their first 2-minute gardening tips for 2015. And we'll check in later on. Well, maybe Richard might call in. I don't know. We'll see how that goes. So we hope you'll stick around for the next 60 minutes or so and join in our conversation. And you can do that via our chat room by going to our main show page at TalkShoe.com and search for call ID 82757. Now, once you're there, just click on the large join button and sign in as a guest, and you're good to go. Once you're in the chat room, you can type your questions or comments at the bottom of the page, and you'll find our phone number and show ID there as well. Now, if you do want to call in tonight, you can do that. The phone number is 1-724-444-7444. You're going to enter the call ID 82757, followed by the pound sign. You can always text your questions or comments to us at 734-788-9319. So sit back, stay warm, grab your favorite beverage, and enjoy the show. Now, let me mention real quick, once you're at our main show page, you'll be able to download whatever shows you would like to listen to at your convenience, whenever and wherever you want. All 229 shows are there, and it's a good way to get caught up on any shows you may have missed. We're also on iTunes. Just search for GC Community Chat. And don't forget, we're doing a video recording of tonight's show so you can put a face with the voice, and that video will be available later on our YouTube channel at youtube.com/community chat show. Okay, before we go any further, let's get the latest weather update from Tom, and we'll see how he's doing. Okay, let's do a check on weather with Doppler Tom. Let's see what he has in store for the rest of this week and the weekend coming up. Tom, take it away. Tom, a little bit warmer, eh?
Yeah, we definitely can shut the heat a little bit down from what we were dealing with last week.
Yeah.
Bitter cold. We even got a lot of snow for this time of year. We've seen a few inches, and that really started to pile up, and the cold wasn't helping, and the wind wasn't helping with the wind chill, but luckily, we're starting to turn a corner. I don't see any significant snow or significant cold in the future, so that's good, finally. But, I mean, this is winter, so we are going to have it from time to time. But for the rest of tonight, we are going to see those high clouds continuing to filter throughout the area. It will probably get into the mid-20s for overnight lows, so not too terribly bad. And then as we get into Friday, we'll again see those high clouds continuing. And we'll probably see temperatures bottoming out pretty much as there are. It's going to stay pretty steady over the next 48 hours in the mid-20s. And then as we get into Saturday, it's going to be overall a good day. It will probably be more clouds than sun. It'll be much milder as well. We'll get above freezing over the weekend. And Saturday, we'll see temperatures in the low to mid-30s. So that's going to be a nice change. And as we get into Saturday night into early Sunday, we're going to see a little bit of moisture moving in with the boundary, and we'll probably see a little bit of snow flurries moving through during the early morning hours, but I'm not expecting any significant accumulation. There probably isn't going to be too much of that. And then as we get into Sunday afternoon, temperatures will probably get up into the upper 30s, so it'll be much milder as we get throughout the day on Sunday, so it'll be pretty nice from what we have been dealing with. And then as we get into next week, including Martin Luther King Day, it'll be pretty much a dry period as we get into next week. I don't see any rain or snow to deal with, but I do see a little bit of a cool down. We're not going to continue to see these mild temperatures like they are this week, but 20s for highs probably is the normal, upper 20s, and low temperatures will probably be in the teens. So that's pretty much common for this time of year, but we can be much worse. There's no big cold or snow as we get into next week. So that's definitely a very good news. But as we expand out and talk about some other weather, overall the weather across the United States tonight is pretty quiet, not too much going on. The biggest weather right now is in the Pacific Northwest as they get the storm system moving in offshore from the Pacific, and they're going to be dealing with a lot of rain, wind, and mountain snow out there, and that'll continue over the next few days. And the Northeast is going to be dealing with a little storm along the coast. Mainly the bigger cities along the I-95 corridor will deal with more than rain than snow, but the higher elevations and interior Northeast will deal with that snow and wind. So a little storm for them as we get into the weekend, so that'll be something that we have to watch. And then the last big weather story is something that has to do with our little friend in the UK, Dave AC. They're dealing with, again, more storm systems. All last week they dealt with a stormy weather, and another storm heading towards them with a lot of wind, rain, and even that high elevation snow. So Dave is probably dealing with some nasty weather out there this last few days, and he's going to deal with a little bit more. So I just wanted to give him a little shout out. But other than that, the majority of the country is dealing with quiet weather as the jet stream goes back into Canada, which is some good news because when it's not in Canada, it's over us and it's cold and it's snowy. Yeah, but it moved back into Canada, so that's some good news. But if you want to keep tuned to the weather, just go to my website, DopplerTimesWeather.com.
All right, yeah, sounds encouraging. Let's not get too hopeful, though.
Oh, I know. It's still winter up until March.
Yeah, we got a long way to go yet, but hey,
Yes, we
don't hurt to think spring. All right. Thank you, Tom. Appreciate that. Okay, back with us again for 2015 with their Gardening in 2 Minutes segment is Joey and Holly. So let's get to them and see what they have for us, and then we'll get to our guests for tonight. Joey and Holly, take it away.
This is Gardening in 2 Minutes. The term homestead brings images of a lot of land in the country, but you can homestead with very little land, or even if you live in an apartment.
Yes, definitely. You can do things like you can grow food in containers, on a balcony, on a patio, on any sort of space you have. You can also look into an indoor growing setup. And if you can't do that, maybe you don't feel that you're able to, you can definitely get things from the farmer's market, and then you can use that to preserve that harvest. Other things that you can do to homestead without land is you can learn how to become more self-sufficient, bake your own bread. If you eat bread, cook for yourself. Perhaps maybe invest in a CSA, which is a community-supported agriculture, and they have all sorts of CSAs now. They have ones for vegetables, for dairy, for meat. So these are things that you can still do to become more self-sufficient.
You can also make products that you use on a daily basis, whether that be cleaning products or your own laundry powder or laundry detergent.
You can definitely do that. You can also look into, perhaps at some point, if you want to look into community garden where you have your own garden plot or an allotment. That way you can continue to grow your own food as well.
There's a multitude of different new technology that's available that you could incorporate into your living space, such as solar panels that can be attached to the inside of windows to reduce the amount of energy you're using, as well as other wonderful technologies that you can do that simply will help you reduce your living costs and make it a little more easier on the environment. For more information on how to be homesteading without land, our weekly video productions, as well as our free downloadable digital quarterly magazine, you can find all that information at
thewisconsinvegetablegardener.com.
For the health-conscious organic gardener worldwide. For Gardening in 2 Minutes, I'm Joey Baird.
And I'm Holly Baird.
All right. Thank you, guys. Good to have you back. Okay, let's introduce our guest for tonight. As I mentioned earlier, he is with the Marketplace Help Center right here in Garden City and was here back in December, the first part of December. And now he says time's running out. So welcome, Mr. David Jevahirian. How you doing, David?
Fantastic, Gary. Thanks for having me on again.
Good, good. So time's running out. What's it?
Yeah.
What's that? Explain.
Well, let's not forget that this year the tax liability, let's call it, for not having insurance is going up.
Okay.
It's not a fine. It's a responsibility payment. I want you to know that.
So people that do their taxes, they have to prove they have some kind of health insurance now.
You're going to have to show health insurance now when you file your taxes, and if you don't, they're going to charge you some fees come tax time against your credit.
And what kind of money are we talking roughly, do you know?
Well, this year and every year it's graduated over the next couple of years to go up, but as we are this year, a single adult would pay $325.
Wow.
For each of your children, you'll pay $162.50. Right up to about $975 for a family. It maxes out. If you have a lot of kids, they're not going to keep charging you. But
Holy
if
cow.
you have a family of 3 or 4, you're going to have almost $1,000 debt on your taxes.
So it's definitely to their benefit to get some kind of insurance and get it now.
And obviously, it's always a benefit to have some insurance. To
Yeah,
take care of you.
right. So when is the deadline?
Well, the final deadline this year for open enrollment is going to be February 15th.
Okay.
If you don't sign up for the 15th, you are not going to be able to sign up again until next year during open enrollment, which is going to be every year from November 15th through February 15th.
Okay, so every year there.
Don't get completely discouraged, though. Anyone that has what would be known as a life change can apply and get a special election period. So in other words, in the middle of the year, if you lose your insurance, if you lose your job, or something changes drastically in your income level, you can report this to the government, and they'll allow you to sign up for a plan in the middle of the year also.
Oh, okay, with no penalty.
With no penalty.
Okay.
Now, to avoid the penalty, though, keep in mind, you have to have a policy for at least 9 months out of the year.
Okay.
Otherwise, you're still going to get fined. Don't think you're going to go out there in October, November next year and pick up a plan for a couple months and avoid the penalty. It doesn't work that way.
Yeah, right.
So you got to keep up on it.
Yeah, kind of like people, they'll get their auto insurance and then they'll cancel it after they get their tabs, right?
Right, yeah, and you got something to show the cop when you get pulled over. It doesn't quite work that way.
No, that doesn't.
Yeah.
So what are some of the examples that people are, what kind of insurance are they getting from you?
Well, that's just it, Kerry. I get excited when I talk about it. People don't realize the deals that are out there. These are not, if you traditionally shop for insurance up till, this past year, you're going to be shocked at what's out there. These are not extremely high deductible plans. If you're mid to lower income, not only do they give you a little help paying for the plan, but they'll lower those deductibles and copays, so you're not having a lot of out-of-pocket expenses. These are really usable plans.
Pretty reasonable then.
Yeah.
Affordable.
They're affordable. And,
Hence the affordable health care plan.
That's the idea. They're certainly not affordable at the top end, but, if you're in middle to low income, the government's going to offset that cost for you. I think what holds a lot of people back is the fear of the unknown. Come in, talk to me. There's no obligation. Sit down for a few minutes with me.
Right.
I'm going to ask you a few questions about, your income and what makes up your family, and we can find out really quick if this is something that's going to benefit you.
So if somebody comes into your office, what do they should be prepared to show you? I mean, do they have to bring anything with them?
I don't actually need any actual documents to make this happen. We need the information. We need your personal information,
Social
Social Securities, your kids. It would be helpful. You need to know what you think you're going to make this year. Everybody's estimating it. They're talking about giving you insurance for 2015. It's based on your income for 2015.
Okay.
So you're going to estimate that. After that, I can give you an idea of what you might expect by filling out an application. I can then assist you fill out an application. We'll find out what kind of tax credits available to help you pay for your insurance. Keep in mind, these tax credits are immediately available to you. In other words, you're not going to have to pay the full price for your insurance and get reimbursed at the end of the year.
Okay.
The government's actually going to send that money on your behalf to a carrier of your choice. These are still private insurance companies that are carrying the policies. You're not getting a quote Obamacare policy or something that the government.
So pretty much
together.
any insurance company, right? I mean, Blue Cross, HAP.
Humana, HAP, they're all online. It requires them to register these policies online with the government each year to follow the guidelines. But there's a lot of choice out there. Quite frankly, I can tell you offhand that Humana is the least expensive out there. Blue Cross is right down there with them. Blue Cross has
Really? A lot of people
actually
think that's
expanded
way out
their
of
programs. Yeah, they've expanded their programs. They have different levels of coverage as far as their HMO networks go.
Okay.
The broader the network, a little bit more you're going to pay for it, but they really want to be down at the lower end, the middle, and the upper end of the
and
market.
be competitive, right? What the
And they're
heck?
being very competitive. So
That's awesome.
it's a matter of who's being competitive in the market. That's who I'm going to recommend to you. Mostly you're going to really look at the networks. That's who's important. Where's my doctor in the networks?
Yeah, that's very
Do they
important.
accept these policies? Do they cover the hospitals that are in my area? And all these things I'm going to handle for you. We're going to make sure that if you have a doctor that's your favorite doctor, we're going to put you in a plan that your doctor accepts.
And you don't charge anybody for this, really, do you? I mean, as far as helping them out.
Generally speaking, there's absolutely no charge for this. You should know that I'm a commissioned salesperson.
Yeah.
I'm registered with all these different carriers. So when it comes down to finding what's right for you, I'm pretty biased. I'm really not biased because I don't care who you go with. I'm
Right.
going to get paid in the end. What's really important is that I match you with something that works for you.
What do
it's
you-
affordable for you.
Best for them.
What's good for you is what's good for me. So know that when you sit down. I've got your best interest at heart.
Good.
And like I said, we're going to do all the research for you, whatever needs to be done to fix
What
your
about
plan.
veterans? You work with a lot of veterans yet? I know, we've worked with Troy.
Yeah, I
Sheehan.
know. Working with the Veterans Association. That has to do with the other products that I work with, actually. When I'm looking at the veterans, I'm looking at the VA who are getting their Medicare.
Okay.
And if they're on Medicare and they're relying on the VA for most of their services, there are some actually free programs that they can get involved in. They're Advantage programs. They'll supplement your Medicare. They will stand right next to your VA benefits. They don't interfere. And they're free to
Wow.
people that are interested in them. So, if you are again, you've got your A and B Medicare card from the government, but you're not purchasing any other insurance. Maybe you're relying on the VA from time to time, but you don't want to be wholly dependent on the VA. You know, we can get you in a program that'll get you to a local doctor for $10.
Wow.
One of the big problems the VA have is emergency service.
Okay.
If I'm relying on the VA for my emergency service, they want me to get to a VA hospital, and if one's not available and I have to go to a private hospital, I'm subject to the VA approving that service, whether they'll pay for it or not. And I may end up with that emergency bill. Under the programs I'm talking about, you can go to a local emergency room for $65 and have all your services covered.
Yeah, that is the problem with the VA is the wait period. I mean, it's ridiculous. Michigan, I hear, is one of the better ones, but I mean, some of these guys are waiting, you know, for treatment, and they're actually dying while they're waiting.
Yeah, and
that's pretty sad.
Those services are just going to get more pinched. So I'm always happy to, if I can take a little off that system and put that someplace else for those gentlemen to get that service. Then
that's awesome.
That's a good thing.
Yep.
You know, as you know, we've talked to Troy, and there's over 10,000 VA heading back into Michigan over the next year. That's a lot for our economy to absorb.
Yeah, it is.
So, you know, hey, if you're out there and you can give a VA a job, you better be thinking about it.
Yep.
People.
Right.
And they need some support. So
Exactly.
But,
So the coverage is out there. I mean, now, I don't know if my wife was going to come up. She was supposed to come up and ask you a question. Let's see. See if she's going to come up. Yeah, she said she's going to come up. So I'll let her ask that. What else did you want to cover there? I know you were going over some examples. There's all different
well,
types.
yeah, you know, again, if you've been shopping before, you're not familiar with what's available out there. These plans are really usable. I can give you a couple quick examples.
Yeah.
I helped a 57-year-old woman recently. She currently makes $17,000 a year.
Uh-huh.
A good middle-of-the-road program for her was going to cost her $469 a month. Obviously, that's something that's out of her means.
Right,
$17 grand a year.
Yeah.
Given those circumstances and parameters, the government, Uncle Sam's willing to pay for $369 a month of her insurance, leaving her only having to pay $100 a month.
Wow.
And this is not some high deductible, unusable plan. This
No.
is a plan that is going to give her
Good coverage.
good
Decent.
coverage, all the basic coverage. She's going to get all her preventative things covered for free. All that testing, her annual physical. She only has a $175 deductible.
Are they still doing the color, the gold, the
Yeah,
metallic?
all these policies are they're what they call metallic level plans.
Yeah.
There's a bronze, a
Bronze.
silver, a gold, and a platinum
Right.
coverage.
Okay.
So you can get different.
Where would
levels of
that
coverage.
fall in that roughly?
This what we're talking about is a silver. It's in the middle of the road.
Oh, okay.
The government, as you approach the lower ends of these income levels, are
Yeah.
not only giving you money to help you pay for your policy,
Mm-hmm.
as I said, they're actually altering the policy, giving it a lower deductible so that she'll have a lower out-of-pocket cost. That's
Okay.
a very good example. They've taken that deductible and lowered it to $175
That's very
in a
good.
silver plan.
Wow.
So you have to be careful, and that's why, you know, my advice is very helpful. The government only offers that in the silver plan. If you are trying to sign up yourself and decide you want a bronze instead, you may be paying more for a plan that covers less than you realize because you're not noticing they're giving you this extra help.
Wow.
So these are very important points.
Yeah, that is important. What else you got
Another
there?
example, I have a family of four. The gentleman's, the wife and husband are in their early 50s. He's self-employed. He makes $38,000 a year, but a plan for just him and his wife would have been $800 a month. In his case, the federal government's giving him help to buy a policy for him and his wife. They're giving him $600 a month, leaving him to pay about $202 a month. And his children are getting help at the state level. They're on a My Child program, which costs him $10 a month for his children.
Wow.
So,
Well, these people got to be really pleased with that. I mean,
that is the best part of this.
Yeah, I
I'm
mean,
really helping some people.
it's
who need the
obviously
help.
working, right?
It's enjoyable,
Right.
and they're getting the help they need.
Cheryl, my wife Cheryl has joined us, and she had, I know, a couple questions for you. Is your mic on there?
Let's remember, Cheryl knows what she's talking about because she's been in this business. So what am I up against?
No, Carrie and I just saw some TV commercials that we were just, kind of caught our ear because we don't have dental and vision coverage anymore.
Okay.
When you
hearing.
retire, you lose it.
From Blue Cross, as a retiree of 38 years, I lost my dental vision and hearing coverage, and it says it makes it look like it's under the Medicare government plan and it's even said no cost to you.
Yeah, I'm on
that,
Medicare.
and then it says call this number, and it makes it.
Yeah,
seem
these are advertisements generally for Advantage programs, and they're telling you, at no cost to you now because of the way everything's set up, and they're making allusions towards this being part of Obamacare.
Yeah, that's exactly what they
Yep.
did.
It really isn't. Keep in mind, the over 65 market, the typical Medicare market, has not been affected in any way or shape from Obamacare the way it sits right now. What they're saying is they have these Advantage programs that you can buy. It's kind of like a supplement. It's really not a supplement, but it stands with your Medicare and works like a supplement. And some of them include dental, optical, hearing coverage for free. There's some added benefits that they folded into these plans.
Okay.
So what they're telling you is if you switch to their plan, you'll get that added dental and optical for free.
Because there was a number, and that's
Yeah.
what I said to him. I said, "There's no way they can offer dental, vision, and hearing for nothing." Because he has Medicare.
Read
Carrie has Medicare.
Yeah.
And it was like, no, I'm
Well-
not even going to call and get pulled into that. 'Cause I paused it and read the fine print, and it was a non-governmental agency, and I
Read
knew
the
that
fine
it-
print,
Yeah,
yeah.
it's frightening. And I'm glad you bring that up.
But people
Just
get
in
sucked
general,
into that.
Well, yeah, and especially elderly people who
Yeah.
are looking for some good advice, and you need to find someone that you trust.
Right.
Unfortunately, when we start Medicare in this country, they hand us a card and they say, "Here's your Medicare card. Congratulations, you worked long enough, and this is your reward. I have Medicare."
Yeah.
No one
Okay.
gives you a manual. No one tells you what.
Yeah,
that
what are you
covers.
entitled to? Right.
You know, why do I have to buy a supplement? Why do I need a Part D? How do they fit together with the Advantage programs and such that are available? And what are my options? I certainly do that. I specialize in the senior market.
Yeah, you need to hold like a
people-
Medicare class, dude.
Yeah, you know
It'd
what?
be-
Sitting with me
it
is a
would be
Medicare
awesome.
class.
Yeah.
If you're starting Medicare
And you
because
know.
you're on disability or you're turning 65,
Yeah.
come on, sit with me. I'm going to explain to you all about how this program works.
That's
I'm
awesome.
going to show you some options that you have. There's no obligation. If you find something that fits you, I can write you up for that. I'm certified. But you need to know what it covers and what it doesn't cover. And
Yeah.
For those of you who have it and don't understand, A and B is you're not covering everything. You're going to still run into some bills. You need drug coverage. And some of those programs actually are free. They are some of the ones I was talking about to work with the VA.
Oh, okay.
Okay, the free program doesn't come with drug coverage, but VA can use the VA for their drug coverage. So they can have basically an Advantage program that's free to them. Limits their out-of-pocket expense, gives them access to the emergency rooms, gives them access to local doctors. And as you said, the program comes with optical, dental, and hearing. They'll actually buy you a hearing aid once every 3 years, test your hearing every year. That's all included for free.
Hear that, Carrie?
Yeah, I hear that.
If not, we can sign you up next year. We'll get you a hearing aid.
Yeah, right. It'd
I
be
get
covered.
so tired of, what? You didn't? I didn't hear you say that.
Yeah.
All right.
It's hard to force men to put our glasses on. We don't want
Oh,
to.
it's hard to decipher between tuning me out and hard of hearing.
Well, yeah. Okay, we won't go there. It's a whole nother show.
Well, anyhow, look, if you're just thinking about it, you're nervous about it, come
Yeah.
on in.
That's
You
the
know,
thing, yeah. Get you in there.
You can make an appointment by calling us at 248.
Yep.
No, I'm sorry. You can make an appointment with our appointment desk. It's 734-634-9408. Someone will get back to you. They'll set up a time for you to come in. If you're thinking you just want to walk in, you can always give me a call on my cell phone. I'm available at 248-765-8220 during the day, and you can just call ahead to find out if I'm busy.
And I'll
Walk
mention
right
that.
in, and we'll take care of walk-ins too, opportunistically as they come in. we
And you're
have time.
located right on Ford Middle Belt.
Yeah, we're right downtown in the business district of Garden City. We're at 29215 Ford Road. We're on the southeast corner, right by Orange Jewelers.
Yep.
Okay, a couple doors down. You can park out back and come in through the building.
And you'll take care of them, I know.
Hey, there's always hot coffee and cheap cookies on the counter. Come on in.
You always tell me that.
Yeah.
I'm going to have to come in there for some of them
we'll
cheap
be
cookies.
right next door tomorrow at noon. We have a DDA.
Oh, yeah. We got a meeting at the DDA. If you're going to be there, we'll
You can
stop by.
come over to the trinkets and trash table, too. We have all sorts of fun stuff like stress balls and bottle
Oh, do you?
openers
I need a
and-
stress ball up here.
There you go.
And work this wrist that I broke.
Come on by. Happy to see you.
Anything else you wanted to ask?
Nope, that was not my general question. I know we've heard a lot in our ear that they have visited David, and he's done them a great service, and they have, if they didn't have insurance before, they have it now, and if they had insurance,
Yeah.
he can make it better. So
Yeah, definitely recommend you.
Most of the people that come in really love me. No one walks away not happy that they didn't talk to me. They're always happy they talked to me.
That's good.
And, I'd like to add, a lot of people understand that the Obamacare that we typically talk about is for people who are working and have some income. If you have very low income or even no income, I want people to know that the Medicaid program in our state has expanded. And you're either going to get help at the federal level paying for a policy that I can assist you with, or you're going to end up with Medicaid this year. Just because you're single, you're not a mother, you think if you applied in the past year and you got turned down, have faith. You will be covered by Medicaid. You're either going to get Medicaid or help paying for a plan this year. Now, when it comes to Medicaid applications, I am happy to offer you free advice on where to go and who to talk to get that handled. I do fill out applications for you if you'd like. It'll save you a day at the DHS so you don't have to sit there. I charge $25 for those applications.
Reasonable.
But if it's going to save you a day sitting at the DHS because you don't want to take it off
Absolutely.
work, and you can come in on a Saturday
That's
afternoon
very
and sit
convenient.
with me for 20 minutes instead of with them for a couple hours, it's a good starting point.
Yeah, well worth it.
So far, no one's turned me down for that.
Right.
So
Well, that
that's
sounds
available
awesome.
Too. Have heart, everyone's getting help this year.
So I'm on Medicare. We're retired. We have Blue Cross. We thank God we have health insurance and we have drug coverage. If I wanted to get, say, a supplemental dental to cover dental,
Yeah, I do provide supplemental policies too for all sorts of different things, Carrie.
I mean, are they pretty reasonable or are they outrageous? It
Yes.
depends probably on the coverage,
Well,
right?
specifically, you have to be careful again when you get into 65 because it's a different market and the
Yep.
products are different. But
Okay.
I do actually have a 65 and older dental and optical plan. Pays very well. Please don't quote me offhand. I think it's $41 a month for
$41
per
a month?
person
Okay.
for a dental program.
And that's
it's
not
like,
outrageous.
No, it's like $16 a month for the optical for the over 65.
Okay.
So, the family's $16 for the dental and $41 for basically for $100 you could have dental and optical coverage. It's a little under $100 a month for a couple.
Okay.
I also have other supplemental programs that are, for lack of a better description, things like Aflac. Typically, you buy Aflac at work,
right.
and you really can't singly. Cancer programs, accident programs. If you get an accident, you're laid up in the hospital, they're going to hand you some cash to pay your bills. If everyone in the family is coming up with cancer, and the national statistics are 1 in every 3 women and 1 in every 2 men are going to contract cancer within their lifetime.
That is scary, isn't it?
So as I sit in the room with you, Carrie, and I'm suggesting maybe you might want a cancer policy,
Yeah.
it's either going to be you or me.
Isn't that
1
crazy?
out of 2.
Wow.
So a lot of people are concerned about that.
Yeah.
These policies, you can get a cancer policy anywhere from $10,000 all the way up to $60,000. You get cancer, they hand you $60,000. Do you have insurance? Yeah. But are you going to be working while you're getting chemo for a month or 2?
Yeah.
You're going to have other bills to pay.
A lot
other
of
things
questions
come
to
up.
answer there,
And,
yeah.
that money is going to make your life a lot more comfortable at a time when it's uncomfortable. So we have those. We have accident policies, disability, short-term disability policies.
So you handle just about everything then?
Yeah,
Really?
life,
You name it.
Medicare, Medicaid, anything, any kind of health or life insurance that you're interested in. That's what I do.
Yeah.
I've been doing a lot of. People are looking at final expense policies. Maybe you don't have large life insurance policies sitting around, but You want something for a decent funeral, don't want to burden your kids with it. These are very simple, easily underwritten policies. We write them right in the office there and do the basic underwriting for you.
I know something with the baby boomers now. I mean, it's like long-term care,
Long-term
insurance,
care is
nursing
a
home.
very big thing. Yeah.
Huge.
Yeah, and it's something that, you know, you need to address when you're younger, because as we get older, just like our life
Yeah.
insurance, that stuff starts costing money.
Yep.
You'd
Yep.
be surprised how much life insurance you can get at 30 years old,
Mm-hmm.
40 years old.
But see, they're not thinking of that.
They're not.
The 20 and
At least
30-year-old, they're not thinking of that stuff.
Yeah.
They're immortal.
You know, even if you don't think it's something you ever thought of, buying a whole life policy, term life is so inexpensive.
Yeah.
You've got a couple of kids,
Yeah.
and, you know, you got to understand something. If you have a couple children, and you're the main breadwinner,
Mm-hmm.
and dad disappears, do you think your kids' lifestyle is going to change a little? Do you think their same friends are going to be their same friends? Are they
Yeah.
going to be going to the same school when you're gone?
Yeah.
You know, if it's
Those are things you
$20
got to ask.
If you're talking about $20 a month
Yeah.
for a term life of $150,000, you know, that's not an awful lot to sacrifice for your kids.
No,
you
it
know,
isn't.
you know, eat one less steak next week. Go out to dinner one less time over a month, and you've got life insurance for your children.
Yep.
So
That's
there's really
what-
no excuse not to have.
That's
something
what puts
when
it
you
in
have kids.
perspective. One night out for dinner, stay home and have grilled cheese sandwiches. I mean, it just,
For something that can provide for your children for the
Yeah.
rest of their life.
Yeah.
Yeah.
You're gone.
Yep.
Pay off the house, keep them living where they're living. It's
Well worth it.
yeah.
So,
All right. Awesome.
okay.
I think we covered a lot. Anything else?
No, just that get in. The 15th is the last day. If you let it go, you're going to have to wait another year, and you're going to pay that responsibility fee on your taxes.
Right.
Let's avoid that. Let's get you some coverage.
Yeah, that's the main thing. They got to have. You got to prove that now, that you have
That was
insurance.
news to me.
Yeah, I told you that. You didn't know that. Of course, I heard it. I think from him. So.
H&R Block's advertising. They're ready to help you with that.
Yeah, I know. All right, and so I'll mention the phone number and contact information again at the end of the show. And
All right.
and the main thing is get in there. The deadline is February.
February 15th, last
Right.
day to sign up for this.
Now you're going to be over there all year.
yeah,
in
I'm
this place?
hoping we're going to be able to keep the location we have year round now.
Because I mean, you sell other insurance too, right? So
Sure. It's just that with the, the open enrollment period has really dwindled it down to most of the business is written during the 3 months. So
Right.
I'd like to keep the office. I probably won't be there every day like I am now.
Yeah, right.
But I will be available by appointment in the office.
Yeah, that would
So
work.
all you have to do is call up and say, I need to talk to you, and we'll make a time to meet there. And
because we definitely want to keep you here in Garden City, that's for sure. You've helped a lot of people. I know. We've heard good things. So.
yeah, I'll tell you what. And the community's been real nice. It's fantastic sitting down with you. I think you're doing a real good community service, and
Thanks.
You're getting the word out there for the other services that are available.
Yeah,
Like mine. It's
yeah,
great.
definitely trying. That's for sure. And don't forget, we got a meeting coming up next month. You can come to
Yep.
GCBA. All right, David. Thank you very much. I appreciate it.
All right, thanks, Gary.
You want to hang around? You can hang around, or if you got to go, you can go. I
I'll
know.
sit for a few minutes, see what
All
you
right.
got going.
All right.
Maybe someone will call in and have a question for
Yeah, you never know. We had quite a few in the chat room. I just wanted to mention today, Governor Snyder signed the sales tax bill. I don't know if everybody heard that, but you're starting in October. You're going to start paying state sales tax on purchases that you purchase online, such as Amazon.com. So that goes into effect in October. I wanted to discuss Senate Bill 789 with Richard, but he isn't here. So I think we'll move along to something else.
Can I talk about my garden club fundraiser?
Oh, absolutely, yeah.
Okay.
Let's talk about your garden club fundraiser.
Okay. Because I have
Is your
something-
mic still on? You talking
Yeah,
into it?
I have something paused downstairs, and
Oh, I'm sorry. Lifetime, right? Lifetime?
yeah.
Lifetime movie. Okay.
This Saturday, 6 o'clock at Good Hope Lutheran Church on Cherry Hill, our Garden City Garden Club is hosting a fundraiser and calendar sale, autograph party. The calendars are available for sale. And we will be autographing between 6 and 7. And then at 7 o'clock, our euchre and pinochle card party starts. $20 entry fee, and we'll be paying cash prizes for first, second, and third place. We'll have the cards, snacks, beverages, and we just invite everybody to come on and
All you
have a
need is
good
the
time.
players.
Yeah, I think we're going to be doing good. We're looking at, hopefully, we've got maybe 20, 30 people committed so far, but we'd surely like
Oh, I think
a few
you'll have more than that. I think it sounds like it.
Well, I'm going by the event on Facebook.
Word's getting out. Yeah. Yeah, the event is on Facebook, so look for it there too.
Yep. So,
If you like euchre and pinochle.
yep, it was, we've had one before and it was just euchre, and we heard from the pinochle players that they don't play euchre, they want to play pinochle. So we're going to have tables going for both.
No,
And,
she does.
Yeah, I play both, so I've got a real,
She's torn.
I've got a real decision to make.
You do play euchre? Okay.
Yeah.
Well, if you have time, come on out. It's a good
Yeah,
time.
and I have a championship to defend because I did win first place at the last one for
Yes, you
euchre.
did.
So hope to see everybody come out.
And it's
We're-
going to be, did you mention where and
Yeah.
what the
at
money's
Good Hope-
going towards?
Good Hope Lutheran Church. It is a fundraiser for our garden club so that we can keep giving out $1,000 scholarships, and we've got some beautification plans for the city, planting trees and getting involved, I believe, at the fire station. We're going to do some work there. So we just want to keep giving back, and we can only do that if we keep putting money into our bank account. So
Right.
hope
And
you
you're a
can help us.
501c3, so.
And we are a 501c3, so looking
All right.
forward to it.
Okay, sounds
And
good.
Carrie, you are going to come by, right?
I don't think so.
Yeah.
I'll stop by and say hi, but I don't play.
All right.
I'll do that. Is that all right?
Yep.
Okay. All right. City Council wanted me to remind you that the first City Council meeting, or not their first City Council meeting, actually it's going to be their second council meeting of 2015, is on Monday, January 26th, 7 p.m. at City Hall. Okay. And that is located at 6,000 Middlebelt Road. Council urges all residents to attend. If you've never attended one, at least attend one if you've never attended any. It's kind of interesting to see how our city government works, so check it out. Some guests for upcoming shows that we're working on. State Representative Robert Kozowski from the 16th District, which includes the city of Wayne and part of Westland, will be our guest on February 5th. Also representing the 11th District, which includes Garden City, Inkster, part of Dearborn Heights, part of Westland, part of Livonia, is newly elected State Representative Julie Plawicki. She's going to come on the show. We're still working out details on her schedule, so as soon as we get her locked in, we will let you know. Don't forget, we are still looking for guests to have on the show for the new year. So if you're interested in coming on and sharing your story, or maybe you own a business or you provide a service that you'd like to share with the surrounding community, then now is the time to contact us so we can get you scheduled for an upcoming show. If you're interested, just drop us a line at gcommunitychat@gmail.com. It's that simple. Now, let me mention the Garden City Business Alliance. They're going to be having their next meeting on February the 13th at 6 p.m. at the Straight Farmhouse in the Grand Parlor, and that's located at 6221 Merriman Road, just north of Ford Road. Now, if you're interested in joining or you'd like more information about the GCBA, check out their website at gardencitybusinessalliance.org, or you can email them at gcbusinessalliance@gmail.com. Also, go to their website, and under the coupons tab, there's some coupons in there that you can check out. It's always good to save money, so check it out. You can print them out right online there. Remember, we will upload this show when it's available to our Facebook page at facebook.com/GCChat. And don't forget to check out our YouTube channel, like I said earlier, at youtube.com/communitychatshow. And while you're there, why not subscribe? All right, I got a couple announcements here that I want to make. February 13th from 12 to 3 p.m., there's going to be a Valentine's Day party at the Maplewood Senior Center. That's located at 31735 Maplewood. Doors open at noon. The tickets are $12 each, and they will be on sale at the Balmoral desk. They're going to have 50/50 and much more, and a great luncheon they have over there. So you'll want to check that out. That'd be a fun time. Also, do you want to go on a free casino trip? Well, the Garden City Kiwanis is having one to the Motor City Casino, and it's going to be Saturday, January 31st. Now, you pay $30, and you get $30 in slot play when you get there, so it's actually virtually a free trip. You can't beat it. Let's see. The bus will depart the Garden City Kmart at 8:15 and arrive at the casino at 9 a.m. Each participant will receive $30 in slot play, like I said. The bus will depart the casino at 2 p.m. and return back to Garden City. So, for $30, you get your transportation down there and back. They give you $30 in slot play. You can't beat it. To make a reservation, call Party Animal Travel at 734-525-9777. They take cash, checks, and credit cards. So, and that's a good deal. That's for the Kiwanis Club. Good people over there. Let me see what else I got here. I mentioned the Garden City Business Alliance. Let's see. Here's one. The Garden City Library wants to teach patrons how to perform a simple yet effective form of exercise. The name of the exercise is Tai Chi, and local instructor Brenda Stewart will be at the library at 10:15 a.m. Thursday, January 22nd. Tai Chi is an ancient Chinese tradition, and it's performed today as a graceful form of exercise. Call the library for more information and to reserve a spot at 734-793-1830. Cheryl mentioned her card party. Don't forget that, January 17th. That's this Saturday at Good Hope Lutheran Church on Cherry Hill. Senior Thrift Store. Good items are available at a low price at the Maplewood Center. Senior Thrift Store. Clothes, shoes, coats, kitchen items, and much more for sale. Store hours at 9 a.m. to 2 p.m. Closed noon to 12:30 for lunch, Monday through Thursday. The Maplewood Center is at 31735 Maplewood, west of Merriman and Garden City. The Friends of the Garden City Historical Museum, they're still doing their fundraiser over there. If you haven't got a brick yet, check that out. They have bricks, starting at $50 for a 4-inch by 8-inch, which holds up to 3 lines of text, and an 8-inch by 8-inch brick for $75. And that has rooms for 6 lines of text. The Lather General Store is open from noon to 3 p.m. They have unique stuff over there. Wednesday and Saturdays, offering a variety of collectibles and gift items. The museum is at the Straight Farmhouse, 6221 Merriman, North Ford Road. And for more information, give them a call at 734-838-0650. They'll also do free tours of the museum, which is very interesting. They have a lot of interesting stuff. Dave, you were mentioning you might donate some pictures or something to them over there.
Oh, yeah. They were looking for some before and afters, and my father was in business in Garden City 50 years ago.
Wow.
Over at the little miniature golf, so I thought I'd get us some older pictures to...
Yeah, they'd love that.
So I thought that'd be neat.
Yeah, that would be cool. And when you're over there, say hi to Mike Lawrence, buddy of mine, good supporter of the show here. He'll give you the tour himself. And ask him about Ralph over there. He'll tell you about Ralph. I won't say no more. That's all I'm going to say. If you want to know, head on over there. The Garden City Kiwanis is always looking for members. The Garden City Kiwanis welcomes individuals to join them for lunch every Thursday at 12:15 at Amantea's Restaurant, 32777 Warren Road in Garden City. For more information, you can contact Julie Slaybaugh at 734-716-8833. And let's mention the Rotary Club, too. They're always looking for members, too. And they just so happen to meet the same day at Amantea's over there on Warren Road in Vinoy in Garden City. And you can contact Steve Kelly, 734-748-1345. Competition there. And that's pretty much all I have, I think. We got 47 minutes. Geez, we're going to have a easy show here tonight. Remember, if you purchased a calendar last year, you need to get one for 2015 from the Garden City Garden Club. It's called Garden City Garden Club Paints It Up in the Garden. Calendars are available at Lucky Dog Luxury Daycare and boarding at 5921 Middlebelt Road in Garden City. You can give them a call at 734-261-7387 to reserve one. Or you can order through their contact page on their website, gcgcweebly.com. And remember to include your name, phone number, email address, and how many you would like. Once again, calendars are only $12, and they thank you for their support. David, did you have anything else?
No, I think I'm all set. Thanks again for coming in. Just remind the folks, 15th's the deadline. Come on and see me. Find out what we can do to help you out.
Right, absolutely. All right, well, I think we're ready to call this a podcast. I just have to do that, even though Richard isn't here.
I forgot I was supposed to help. Next time.
Once again, congratulations to Richard and his son and daughter-in-law on their birth of their boy, 6 pounds, 9 ounces, Richard Thomas LeBlanc. And we'll see you next week, Richard. I want to thank everyone that participated in tonight's show. Special thanks to David Jevahirian from the Marketplace Help Center. If you need insurance help, you can call David once again at 734-634-9408. Correct?
No.
Or is that different?
Yes, you're right.
Okay. Also, thanks to Tom, my co-host. Tom, great job as always with the weather. And to Joey and Holly from Wisconsin, by golly. Thank you very much, Holly and Joey. Also, thanks to everyone who hung out in the chat room with us. We really appreciate it. Remember, for the latest weather, go to DopplerTomsWeather.com, DopplerTomsWeather.com. He's got a nice little website over there. Also, if you have a show idea or a guest you'd like us to try and get on, send us an email at gccommunitychat@gmail.com. We'll do our very best to provide that for you. Don't forget to join our mailing list at the same email address. So we hope you enjoyed tonight's show. Remember, the success of a community depends on the community, so please support your local businesses like David. And also, if you see something, say something. Look out for one another out there. And check out and subscribe to our YouTube channel at youtube.com/communitychatshow. So on behalf of Richard, wherever you are, and Tom and Joey and Holly, thanks for listening. Take care, and see you next Thursday right here on TalkShoe.com. Have a great night.